Good morning, students. My name is Shirobor. Today we'll speak about the radiation diagnostic of respiratory system. This is the plan of our lecture. Please pause and write it up. The pulmonary diseases, of course, is one of the most frequent pathologies during the pandemic situations, more than like increased in 5, maybe 10 times, and it's much more dangerous nowadays. And that's why we need to know the radiological diagnostics of diseases of respiratory system. So the main methods of the radiological diagnostics of the respiratory system, it's of course X-ray methods. X-ray methods, main one. So all of the X-ray methods are the X-ray, electronic X-ray, digital X-ray, CT scan, fluoroscopy, all of them using the uh, X-ray tube. But the receiving part is the other one, so different. That's why these methods can be a little bit different, and functions of them of course can be different as well. This is the X-ray, normal X-ray, using the X-ray tube and receiving part. It can be like in classical X-ray, it's an X-ray film. In the digital X-ray, it's a dosimetric detector which giving information to the computer, and after that, computer taking the information to us, and we can, according to this picture, we can make our conclusion and the diagnosis of diseases. So, what is the benefits of this method? It's fast, it's giving a lot of information about the not only lungs but also about the heart, about the bronchi, about the bones, about the other organs of chest cavity, for example the diaphragm, about the pleura, etc. most of these methods most of methods need to be made in two projections. Why? Because sometimes in the front projection we cannot clearly visualize the pathology comparing to side projection and opposite. So at least two projections are preferable. Next, this is the linear tomography. What does that mean? Tomography is giving us tomes, so layer imagination of the lungs in our case. What does that mean? So we have X-ray tube which spinning around the patient and a lot of detectors which taking the information of these X-ray tubes. So that's why we can make small imagination, like 1-2 millimeter imagination of the any layer, and at the same time we can make it millions of them. But we need only, for example, the part, right? We can take only this part, but still at the same time, because the patient taking the radiation for a long time, it's much more harmful for comparing to X-ray, but giving more information. For example, in some cases, X-ray can give the pathology inflammation of the lungs for like 30, 35, 40% of lungs. At the same time, CT scan can giving the 60, 65. So it's much more accurate than comparing to X-ray. Bronchography. Please pause and write down what is the bronchography is. So what is the bronchi is? To make it clear, bronchi is like the tree which giving the air to our lungs. So this is the bronchi. This is the bronchi. For example, here we can see that we are by the using of the fluoroscopy with barium, we can see the obstruction of the bronchi. So the passageway of bronchi is closed in this area. That means that we don't have the passageway here, and there is a problem. So it can be the tumor, can be the blood clot, can be the narrowing, can be the inflammation, whatever. So we know the pathology is here. We actually cannot know what exact pathology is, but we know the place, location, and how we can make it better. How can we help the patient? How can we treat such condition? Here also we can see the bronchial tree. We have main bronchi, then first, second, third step bronchi, etc. till the bronchioles. Bronchioles is the smallest bronchi, which is connected to the alveoli in giving them oxygen. Angiopulmonography. Angio, it means the blood vessels. Pulmonography, it means that lungs. So here we can see the heart and the vascular system of all lungs. Here we can write down what can we diagnose during this click case, and from right you can see the what kind of picture we get during this investigation, just like here, for example. Please pause and write down. This is the chemogram. Chemogram is old method which not useful nowadays, but you need to know that that was the one of the most useful methods that we have used. So, this is the X-ray and CT scan. What is the difference? What you can see? How can you see? From the left side, it's a X-ray field. It's giving us two-dimensional, static, projectional imagination. And from right side, it's the CT scan. It's giving us two-dimensional, static, but tomographic imagination. It means that it can give us even small pictures like 1-2 millimeter picture and give us exact localization of pathology. This is the main point of CT scan advantage. Of course, comparing to this, it's giving more radiations. So this is the CT scan machine. You can see it. So CT methods. Please pause and write down them. From left side, we can see the 3D imagination of bones by CT scan. Why it's needed? For the accurate diagnostic of the fractures, dislocations of bones, etc., etc., etc. Here we can see 3D reconstruction of bronchi. Of course, we can see that whereas the passageway is not clear, we can see whereas the branches are going, etc. This is the MRI. MRI is more clearly giving us information about soft tissue, but about the lungs, it's not so effective like CT scan. But if we don't have another choice, if patient cannot take a high radiation dose, or maybe there is no CT scan near us, we cannot use it, we also can use MRI as well. So this is the pictures, you can see them. Ultrasound scan or ultrasound machine. It can give us information if we have pleural fluid or liquid, yeah, pathologies of the lungs in the subpleural sections, inflammation, tumors, atelectasis. Also, mediastinal lymph nodes, pulmonary embolism. This is the Doppler effect. By the using of Doppler effect, we can see, we can find out about the blood flow, blood supply of organs. Please write down. Radionuclide methods. Radionuclide methods, as we said before, giving us information about the spots, cold spots or hot spots of inflammation, probably maybe about the tumors. So it's giving us information not about what kind of pathology, but it's giving us information about where is exactly it's located. So this is the point. And in early stages as well. It's using RPages such as like iodine, gold, the technetium, etc., etc. But it's not our main point for today. So this is the R&D radionuclide methods. This is, you can just pause and check them. This is not the point. So this is the main parameters of the X-ray of lungs. First, pulmonary field. Pulmonary field. This is the, you can write down to make it easier. This is this darker, more black region on the picture, in the picture. So it's showing us the where it's located, what size of this, what percent of this field is like aerial, which giving us air, which is not filled with the connective tissue, and in this picture it's pretty normal, pretty, yeah, not much, but yeah. Roots, these are the, as it's shown, it is the main blood vessels of the lungs. So it's what does that mean? It means that it's giving us information about the main arteries and veins of the bronchi, of the lungs. You need to know that it's not showing us the bronchi. Bronchi normally not seen if there is no such any kind of inflammation, or maybe they're not filled with connective tissue. So in normal cases, we can see only the blood vessels. If it's pulmonary roots, it's a bigger arteries and veins near the heart. If it's the pulmonary pattern, it is the small first and second stage blood vessels that we can see like a tree, right? Like a tree, we can see this pattern or picture of the lung in the inside of field. So this is the size, this is the sections that how we are dividing the lungs, fields of lung, to the 9 parts for each. Please write it down and pause. This is the segments and the of the both lungs. Please write down as well. X-ray symptoms that we are using. This is the dimming symptom or shadowing symptom or shading symptom. This symptom is giving us information that something high, more high density than lungs is located inside of lungs, maybe near some organs, maybe near some pathologies. So according to this information, we can see, we can diagnose some kind of diseases. This is the 9 syndromes that we can see during the investigation. So first is total shadowing or total dimming or total shading, whatever you will call it. It means that one lung or two halves of two lungs are like have shadow. So as we said before, previous symptom. Second one is subtotal. Subtotal, it means that the shadowing or shading is like a little bit like half of one lung. Yeah. Next one, limited shadow. It's about the segment or lobe shadowing. Yeah. Next, third one, round shadow. It means that the whole round shaped shadow is filled with something. Maybe it's like connective tissue, maybe it's a blood, maybe it's a pus. Next, foci or limited focal dissemination. It's like on number 4. It means that there is something, some pathologies, inflammation is shaped like points, but it's located in one area. It's bordered with one area. Next, extensive focal dissemination. It means that this dissemination is more than one lobe. It can be one lung, two lung, half of lung, etc. Next, extensive enlinement. Enlinement is opposite to shadowing or shading. It means that on the lung picture we cannot see any roots, we cannot see any pattern, we cannot see bones, we cannot see anything. That means enlightenment. Limited enlightenment, it is the same, but it is bordered with some maybe lobe, maybe some part, maybe half of lung. Next, limited change in pulmonary pattern. It means that pulmonary pattern can be enlarged, can be disappear, can change its shape, or can be dislocated with something. And the last one is change in the roots of the lungs. Also can be enlarged, can be small, can be dislocated with something. So all of these symptoms are characterized for some diseases. We will speak about them on the practical class. For now, our lecture is over. Please, if you have some questions, I have some questions for the teachers on your practical class. See you. Thank you for your attention.